Hey everybody, I've made 2 attempts at doing a day 2 update post-op from my L4-L5 total disc replacement videos today, and they keep getting blocked, and I don't know why. I've making attempts to appeal both of them, but it's just not going through, so I just wanted to give a quick update, and I guess I'm just going to have to censor this entirely. So on the 7th in the morning, I had a total disc replacement of my lumbar L4-L5 vertebral disc, and it's two titanium plates and a disc, like it's a high-grade plastic disc in between. It was an abdominal approach, which means they went through my belly. So I have a kind of a large incision on my tummy. Today I've been having a lot more pain than I've been having, but coming out, if you haven't watched the previous videos, coming out of anesthesia from surgery, I found that I was paralyzed. From just a complication, but from a complication with the surgery. It was not expected. It's something that they've only seen one other case of. These doctors hadn't even, it was a colleague that they knew. So my neurosurgeon reached out to him. He said that his patient was a man quite a few years ago that lost partial of one leg, and that it came back, and it was due to Exparel, and that's a bupivacaine. So it's a local anesthetic that they put in your belly afterwards and inject around your spine for pain management for the first up to 72 hours. It keeps it pretty numb, but it's like rare to not that you would have this reaction going anywhere other than in your abdomen and where it's supposed to be at. And so when I woke up and I had zero motion or sensation below pretty much my incision, they were very confused, didn't know why. So making slow progress. I have some spots where I have sensation and I have a little bit of movement, but the sensation is like on the top of my thighs, on the top of my foot a little bit, but it's not correct sensation. I can't feel the bottoms of my feet. I can't feel my feet or like where my legs are in respect to the rest of my body. But I worked with physical therapy and occupational therapy yesterday, and then they just came today, and I, with 2 big men assisting and then with the walker, I was able to go into a stand with the walker. I am doing most of this with my arms, but to bring my body upright is super confidence boosting. Like the fear that I had coming out of anesthesia and finding that my lower half of my body was gone in regards to use was terrifying. It was my biggest fear, like from that surgery to coming to life. And so just being upright, even though like I couldn't figure out where my feet were under me and stuff, I was able to move my legs forward in a little bit of a shuffle and take some steps forward, and like it meant so much to be able to do that. And so feeling really positive about it. I'm feeling emotional about it. I don't know how long I'm going to be in the hospital. I had expected that I was going to be home already, and I'm not, but that's okay, because right now we're just taking it one day at a time, one moment at a time, and I just want to encourage others that, things happen that we don't expect, but it's okay, and it's okay. You take things that come at you in life and you do what you can. You do the best you can with them. Try not to kick yourself down. Just fight hard, and push yourself. The human body is amazing. It's amazing at healing. It's amazing at overcoming things. your brain plays a big role in it. We can't overcome all things that we have, like some things we have to learn to live with, but that's part of resilience. And I'm just trying to practice that resilience as much as possible. I don't know how much I'm going to get back, if I get everything back, if I just get part back. I don't know right now. There's a lot of very big unknowns because there just aren't any cases of this. And so, yeah, I'm learning along the way. The doctors are learning along the way with me, and they've been amazing. It's a great team of surgeons, neurosurgeons, like all these different physicians working together so well. The staff have been amazing. So I don't want that to discourage anyone. Like, this procedure is amazing. People hear of spinal fusions most frequently, where your spine is fused because of degenerating discs and herniated discs, and people end up with fusions. But a disc replacement allows you to keep your mobility and to like not have to go back in for surgery after surgery after surgery, because your back, your discs above and below become way more load bearing, and so over time they're going to break down more because the fused area puts more strain on the areas above it. So that's why we avoided a fusion for me and went for the disc replacement. You have to meet a lot of criteria to be a candidate for disc replacement, and I was able to meet that criteria, and I'm excited about that. I'm excited about, once we're through this recovery period, whatever may come, I'm hoping, I'm praying that, I'm going to get my life back, and at least, with decreased pain, because pain has been such a thing holding me back from all the things I love, like aerial silks, horses, all of those things. And so I'm really hoping and praying that those things will, be back a part of my life again. And so this vlog, I really just wanted to answer people's questions. There's just not a whole lot of patient perspectives out there of what a total disc replacement is like. I see lots of physician stuff posting, telling you about it a little bit, but like seeing a patient perspective is helpful for me, and I couldn't find a lot of it, so I wanted to provide that for people. So if you have questions, ask them in the comments. I'd love to try and answer as much as I can from my personal experience right now. I mean, we're only, I just had this done on the morning of the 7th, and, I've been going through this, but, yeah, if you have questions, I'd love to answer. I did tons of research prior to, so, I can try and provide some resources as well if that's helpful to people. So yeah, like, come along this journey with me. I'm going to try and do daily updates, maybe a couple times a day. I had two just sitting waiting to post, well, they're posted, but they got rejected, so I'm hoping that the appeals go through. So hopefully they will, so that I can, be able to share that stuff with you guys. But thank you so much for coming on this journey with me, and I appreciate you and appreciate the love and the concerns and the good vibes that you guys have sent my way. I really do appreciate it. So see ya tomorrow on the flip side. Bye.